Hi, Chapter 6 Medical Practitioners 2. A. Hospital staff. The people who work in name type of work place, including hospital, are called the staff. The medical staff in Bridge Hospital belong to one of four main groups and a pre-registration house officer PRHO or house official is a newly graduate doctor in the first year of postgraduate training. After a year, he or he or she becomes a registered medical practitioner. In the in the current in the current system of training, the foundation program the name or this junior doctor is condition year one doctor F FY1. A senior house officer CHO is in the second year of postgraduate training. The title is now Foundation Year to Doctor F FY2, but the old terms senior house officer and ace age or still used. A specialized registered SPR is a doctor who has completed the foundation program and is training one of the medical specialists. There are also um, some non training registered doctor who has completed their training but do not wish to specialize yet. Um, a consultant is qualif- the fully qualified specialist. There may also be some associate specialists, senior doctor who do not wish to become consultants. In addition, there is at least one medical or clinical director is responsible for all of medical staff. V. Medical teams. Consultants, physicians, and surgeons are responsible for a for a for a specific number of patients in the hospital. Each consultant has a team of junior doctor to help and wherefore those patients in many hospitals they are multidisciplinary um, tips teams which consist not only of doctor but also of physiotherapy and other Elliot um, health professional. When patients enter or are admitted to hospital, they are usually sent first by one of the junior doctor on the ward where they will receive res, ref, receive trunker. The junior doctor clears them, takes their medical um, history and examine, then sometime later the register also see the patient and make other investigation or tests. For example, X-rays or an ECG make a provisional diagnostic and doing um, threatening. The consultant usually says the new admissions people who has presently um, presently be admitted to work for the sixth time on one of the regular wall rooms when the management of the patient is discussed uh, with the registrar. Consultant also decide when a patient is ready to be discharged, sent home. On the ward from the consulta is an accompanied by team and nurse and they visit all the patient in the consulta care. C. Shifts. Junior doctor now normally work in shift, which name they normally work for 8 hour every day. For example, um, 7 a, 7 a.m. to 3 p.m. and or the free until 7 um, a.m. the next day. After a weekday, after a weekday change to a different shift. For example, 3 to 11 to 7 a.m. The alternative system into work from 9 and to 5 p.m. every day and to take turns to be on all available available to return to the hospital is if necessary from from pine from p.m. to 9 a.m. the next the next day, and days on calls and set out in a ruta or list of name attend doctor. Call carry at radio and pager or bleeper, and I devise which name annoyed when someone is training to control time. Um, Practicantes médicos 2. Personal del hospital. Se denomina personal a las personas que trabajan en cualquier tipo de lugar de trabajo, incluidos los hospitales. El personal médico es un hospital británico que pertenece a uno de los cuatro grupos principales. Un funcionario interno de preinscripción, PRHO, o funcionario interno es un médico recién graduado en el primer año de formación de posgrado. Después de un año se convierte en médico registrado facultativo. En el actual sistema de formación, el programa funcionario de estos médicos jóvenes son médicos del año de función. Un oficial superior de la casa está de la casa SHO, está en el segundo año de formación de posgrado. El título ahora es el título ahora es el médico de segundo año de función, pero los términos anteriores oficiales superiores de la casa todavía se utilizan. Un registrador especialista es un médico que ha completado el programa básico y se está formando en una de las especialidades médicas. También hay algunos registradores sin formación médicos que hayan completado su formación, pero aún no desean, especializarse. Un consultor es el especialista totalmente calificado. También puede haber algunos especialistas asociados, médicos experimentados, que no desean convertirse en consultores. Además, hay menos de un director médico o clínico que es el responsable de todo el personal médico. Equipos médicos. Los médicos y cirujanos consultores son responsables de un número específico de pacientes en el hospital. En el hospital. Cada consultor tiene un equipo de médicos jóvenes para ayudar a cuidar a esos pacientes. En muchos hospitales existen equipos multidisciplinarios que no solo están formados por médicos, sino también de fisioterapeutas y otros profesionales de la salud aliados. Cuando los pacientes ingresan al hospital, generalmente son atendidos primero por uno de los médicos jóvenes de la sala donde recibirá tratamiento y atención. El médico junior los atiende, toma su historial médico y los examina. Y los examina. Tiempo después, el registrador también ve los pacientes y puede ordenar exámenes o pruebas. Por ejemplo, radiografía o ecocardiograma. Hacer un diagnóstico provisional y comenzar el tratamiento. El consultor suele ver los nuevos ingresos, personas que recientemente han ingresado por primera vez en la sala, en una de las rondas regulares de la sala, cuando se dificulte el manejo de los pacientes con el registrador. Los consultores también deciden cuándo un paciente está listo para ser dado de alta, enviado a casa. En esta en esta visita a la sala, el consultor está acompañado por el equipo por el equipo y una enfermera y visitan a todos los pacientes bajo su cuidado. Turno. Los médicos jóvenes ahora normalmente trabajan por turno, lo que significa que normalmente trabajan 8 horas al día. Por ejemplo, de 7 a 15 horas. Y luego están libres hasta las 7 de la mañana del día siguiente. Después de una semana cambian a otro turno, por ejemplo, de 15 a 23 horas o de 23 a 7 horas. El sistema alternativo es trabajar de 9 a.m. a 5 p.m. todos los días y turnos para estar de guardia, disponible para regresar al hospital si es necesario, de 5 p.m. a 9 p.m. del día siguiente. Los días de guardia se establecen en una lista de nombres y horarios. Los médicos de guardia llevan un buscapersonas o un buscapersonas o un dispositivo, que este es un dispositivo que emite un ruido cuando alguien intenta comunicarse con ellos. Um, 6.3. 6.1. Excuse me. 6.1. Make your combination using a word from each boss. Associate specialist, house officer, on call, provisional, diagnosis, radio, pager, word, round. 6.2. Match the patient which the job titles. Titles. One, doctor Dr. Granham has been a pediatrician for 8 years and is responsible for tracking the children admit to war seats. Um, consultant. Sí, consultant. Dr. Stewart has who started the second year of her foundation program, the SHO. Dr. Singh has started his training as a surgeon, a especially registered. Dr. Fields Dr. Phillips has hosts graduate and is working in a large hospital in in Birmingham. E. PRHO or House Officer. Dr. Miller is in charge of the medical staff in the Birmingham hospital in the Birmingham hospital. Um, V medical medical director. Um, 6.3 are the following true all for fine reason for your answers. 1. A medical graduate becomes registered 2 years of uh, 2 years after graduation. False. 2. The system of training doctor in Britain is called the Foundation Program. True. 3. The name the name senior house officer in no longer is in Britain. False. 4. The consultant is uh, usually the first doctor to see new patient. False. 5. When working in shifts, a doctor takes to be on call. False. And 6.4. Complete the tests of a PRHO describing her job. When I had to when I head to the work, the first thing I do is talk to the house officer who 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 has on who has on during the last shifts to find out if there has been named new admission. Then I general, generally, generally uh, see see the charts null. And he tells me if there is 90 that is 90 that needs to be done urgently, such as Travenos lines to put pop or tape game. Near in Normandy, I clerk any new patient which basically involves taking a history onto West, taking a history, taking a history onto Wednesday and, Friday morning the consultats does her work route and A has to make sure a complete up to date on the her patient that and so on in the after in the afternoon. I have to the breads for any patient who are to be discharged the next day. They are usually happy to be going home, and the of course they are the lectures and tutorial in the foundation program on Monday and Wednesday.